How are you guys doing today?
Very good.
You can, when you come online, just turn the camera on so I know you guys are there. Okay. So we're gonna go over the workbook growth and development first, and then we'll start with. Can you guys see my screen?
Yes.
Awesome. So let's pick up the workbook, and then we'll go over growth and development.
The answers?
Yeah, we'll discuss that, and then we'll start the new topic. Uh-oh. Okay, so whenever you guys ready, let me know. And Nima, you can start from 1 to 5. And then Pam, you can do 6 to 10. Okay?
Okay. Give me 2 seconds.
No worries. I'm just gonna grab some water. Okay, back. Okay, guys, ready?
Yeah.
Okay, you can start now.
3-month-old infants can raise their heads and shoulders when lying on their stomach. True.
Good.
3. Toilet training is usually completed by the age of 1 or 2 years, 1.5 or 2 years. False?
Yeah, it's 3 years.
3-year-olds are able to play with other children. True. Young adulthood is a time when partners spend more time alone. False?
Young adulthood. No, true. Remember we were teenagers?
Oh, yes.
Okay, number 5.
Do I have to do all the way?
No, just do up to 5 and then Pam will do 6 to 10.
Okay. Adolescence begins to think about career and what to do after high school graduation. True.
Yeah. Okay, Pam, you start 6 and then do until up to 10.
Okay. Number 6, the term growth refers to physical changes that can be measured and that occur in a steady and organized manner. True.
That's good. Yeah.
Question number 7, development is a change in psychological and social functioning. True.
True, that's good.
Number 8, children should develop at the same rate. False. Number 9, a 4-year-old child has a strong preference for a parent of the same sex. False.
Yeah, they go opposite sex.
Number 10, at 8 years of age, peer group activities and opinions are important to the child. True.
True, that's good. Okay, Nima, can you go 11 to, how many is more there? Hi, you can do 11 and 12.
Okay. Puberty begins when respiratory organs begin to function. False?
No, true. When reproductive, yeah, puberty is true. When puberty begins, when the reproductive organ begin to function. Okay.
Yeah, during young adulthood, hobbies and pastimes can be pursued since more free time is available. True.
That's good. Yeah. Mhm. Okay.
Yes, Ron.
Knock, knock. What's up?
Coming.
Yes, Sam. Ron. Okay. So, Pam, number 13, what do you think is the answers?
Okay. Multiple response. A, B, D, E, F, G.
Which of the among the 6 basic principles of growth? Purpose of is simple and complex, yes. Growth and development, yes. Yeah, there you got it. Okay, why don't you do 14 to 16 and then 17 and then Nima will do 18 to 21. Okay?
Okay. Multiple choice. The
Yes.
stage of infancy is the first how much is it? First 4 weeks of life.
3 months.
Which reflexes does the infant need for
Excuse me.
feeding? It's
More rooting.
oral statutory.
Rooting. When you put the finger, they turn the head on and start sucking on it. So it's B, the rooting and sucking reflex.
At what age are solid foods usually introduced to an infant?
It starts around 6 months. So A, fifth to 7th month.
Okay. A
Average.
toddler,
Huh?
17. A toddler should be able to use a spoon and cup.
Yep. They'll be able to hold grass on the spoon and they can feed themselves from a cup. They'll be messy, but yes, they can do it. Okay, Nima, you can do 18 to 21.
Okay. During which stage do children begin to play with another children? C, the preschool years.
That's good.
And number 19 is puberty. C.
Yes.
Middle adulthood is the period of about 40 to 65 years old.
Awesome. Yes.
And then middle adulthood is usually at a time when children are grown and leave home.
That's good. Yeah. So 22, what stages of growth and development includes the following development tasks? Just physical changes, having grown children, developing leisure is late adulthood. Okay, I is the answer for that. What is the stages of growth? Include the following development tasks: ability to communicate with and understanding others, performing self-care activities, learning differences, develops sexual morality, learning to play with others, and developing family relationship. What do you think is the answer?
Preschool.
That's correct. Yes. Have you guys done the matching? Have you guys done that yet or no?
No.
Yeah, there's lots. Okay, if you haven't done it, we'll just leave it for now. And I'll give you some time later after the class and you guys can finish and we can discuss at the end.
Yeah.
Okay. So that's the same one that I remember I asked you to do at the end of the topic. So those are the answers for that. So we're doing chapter, I don't have the right chapter here. I got it, chapter 32. Is that correct?
Yes,
Yeah.
it is.
Okay. So let's get into your books. Let's go to some, over some of the important key terms. The first one is anatomical position. You can see the guy on the next page. That's anatomical when you have your arms flexed and standing straight. That's the anatomical. That's when you divide into 4 quadrants: straight and then transverse. Okay. So if you ever somebody said, okay, put him in anatomical position, that's how you're gonna do it. You don't need to know. Capillaries are tiny blood vessels, so our bodies are made. Major is the arteries, and then arteries branch into capillaries, which goes to the small cells to provide food and nutrition and oxygen. Okay. Cells, you guys know, digestion is a process where the food gets digested and turns into shine. Distal means away from the point, and proximal is opposite of that. So, for example, if I say the finger is distal to elbow, that means it's away from the elbow, but it's proximal to the wrist. That means it's closer to the wrist. That's how they define if there's an injury and stuff like that. So you probably don't need to know all this, but it's just for your own knowledge. Hemoglobin. Hemoglobin is the part in red blood cells which carries oxygen. So if somebody is low on red blood cells, that's what they transfuse, and then the condition that results of lack of hemoglobin is called anemia. Okay. So you probably have like people, he's anemic, so they take the vitamin B12 and iron pills just to replace that. And if they are severe, then they get regular blood transfusions in the hospitals. Homeostasis is the stable internal movement of our body. So homeostasis is like tic-tac-toe, the one you play in the park. One side goes up, one side goes down, and when the homeostasis has to be balanced. So if your oxygen goes high, then the carbon dioxide goes low, then you can get toxicity, oxygen toxicity. If the carbon dioxide goes, you get carbonic acid. So it has to be balanced. So that's what body's homeostasis is. Hormones, you guys know, hormones are the part of the endocrine system that balances the body mechanism. Lateral, medial. So organ is each organ, and organ system is how those organs go together to function. We're going to go into a little details. If not, then I'll explain you what organ system means. Peripheral is away from the center of the body, or it's called other word is proximal. So perithalsis, remember I mentioned yesterday, is an involuntary movement of the esophagus and then the colon. It just goes like a balloon, and then moving the food particle, the chyme, down their body to be excreted. Respiration, you guys know. So superficial is on top of your skin. It's superficial. Veins is the blood vessel that returns the deoxygenated blood back to the heart, and then transport. There's only one vein in our body that carries oxygenated blood. Anyone knows that? Which blood vein is that? Give it a shot. No answer would be wrong. There's only one vein in our heart, in our body that carries oxygenated blood. and the rest they carry deoxygenated blood. Nima, any idea?
No.
How about you, Pam? Any idea? It's
No,
pulmonary.
sir. No, sir.
It's pulmonary vein. So anything that's coming towards the heart, the blood that comes towards your heart is called the vein that brings it to the heart. So the vein that brings the pulmonary vein brings the oxygenated blood from your lungs to the heart to get pumped out. So anything coming towards the heart is veins. Anything going away from the heart is arteries. So pulmonary vein is the only vein that brings the oxygenated blood to the heart to get pumped out. Okay, remember that. That's why you probably have had in your career somebody having pulmonary embolism. It is very important if somebody has a clot that can break, make it to your heart, gets pumped in the lungs, and then gets pumped back in the through the pulmonary vein. And if it blocks, that's called that person has a heart failure, heart attack. Myocardial infarction, that's the medical term for that. So they will get blocked, and so the blood won't come to the heart, and there won't be any oxygenator, so heart will die, and that's it, the person dies. So it's really important. If you see any clotting or anything, let your nurse know, the doctor know, that so you notice some blacking of the veins or blacking of the arteries somewhere, and that clot can be dealt with. I've no, like in my career, only one person I've seen die with the pulmonary embolism, and when she was dead, the mouth was open, and I can see like a slug. Have you seen a black slug outside? That crawls. It was like a big slug. It was about 4 centimeter long, and it was on her tongue. So we removed that, and then that's the first time I've seen how pulmonary embolism looks like. Okay. So body structure and function. So today we're going to do like different functions of the body. Offhand, can you guys tell me any system functions you know? Was a responsibility of heart to pump the blood, responsibility of lungs to oxygenate the blood, kidneys pumps the waste out, the uric acid. So there's a function like when there's too much fluid in your body, the brain signal to the kidneys to send hormone called aldosterone to the heart. So when the hormone make it to the heart start beating faster, your blood pressure goes up. So when your blood pressure goes up, your heart is beating faster, taking more fluid to the kidneys to get pumped out. But on the other hand, if somebody is dehydrated, the brain sends the signal to the kidney, where in the kidney there's a structure called medulla that is responsible for regulating. It's like a brain of the kidneys, will send a messenger to the heart to slow down. So that's when your blood pressure drops and the less fluid gets pumped out of your heart, because you need certain amount of fluid in order to survive. Okay. Any questions on that? So this is how our body function works. There's more complex one, but you don't have to know. So the basic one is like if somebody's blood pressure is going up, most likely they have too much fluid. That's why, like when the term is called, like when somebody has too much fluid, is called hyper, HYPA, volemic shock. The person can have a stroke. One of the veins can bust because of the pressure that's going in the internal arteries. And then if it goes low, it's known as hypo. Anything low, hypo, HYPO means low. HYPE means high, like hypertension, that is high blood pressure. Hypotension means low. Hypo, if somebody has hypovolemic shock, like if you get stranded somewhere in a cold, your body intends to shut down, and that's known as hypovolemic shock. So your blood pressure will keep dropping until your heart stops. And on the other hand, the hypervolemic shock is the heart keep going up, trying to pump out the fluid, and the person end up getting stroke because there's a tremendous amount of pressure in between the person. Okay. And to understand the blood pressure, have you ever noticed anybody with the blood pressure taking the top and the bottom? What this means?
Sorry, taking.
If you like, if you had your blood pressure taken, the top number, what does that indicate to you? Do you know? That one is known as systolic. Systolic is the top number. It's like it's going to say 120/60. So the top one is known as systolic. Is the pressure. At the pressure, the blood leaves the heart. The pressure of the artery. The bottom number is known as diastolic. It's the pressure that the blood returns to your heart. So you go 120/60, right? That's the pressure it leaves. Bottom is the pressure it returns to your heart. So the normal blood pressure is around 120, between 100 and 125, 128 is normal. If it goes over that, like over 130, that's called prehypertension. That means the person has to start putting on medication. And if it goes over 140, the systolic, it is considered hypertension. So if you take somebody's blood pressure and it's 180/110, it's crucial. You call 911 because that person will have a stroke in minutes.
Okay.
Okay?
Yes, sir.
Yeah. And sometimes somebody has a severe pain, the blood pressure also goes up. Like especially if you're dealing with patients who has dementia, they will not be able to tell you that they have pain. They will be acting weird. They get agitated. The behavior changes, and then now get your nurse to do the blood pressure. If the blood pressure is high, 90% of the time they are in pain. Okay, and then you control the pain, the blood pressure drops. So autonomy is the study of body structure. Physiology is study of how your body works. So before you start your nursing, you will do a physiology, and autonomy is one of the classes that you're gonna take. Understanding the autonomy is how the body functions, and then how the body structure works. Understanding the normal function will help you understand and identify changes in your body. So understanding the normal function will help you to identify changes in your body. As I mentioned, the blood pressure will drop, the blood pressure goes up from the like I see the puberty. When they reach the puberty, body structure changes, voice go deeper. These are the changes that's going to occur, and you will be able to understand why are these changes happening. The person, when it gets older, they lose elasticity. The subcutaneous layer on your skin is gone, and then the skin becomes like a thin paper. So right now you're gonna pull your skin. That's called skin turgor. You would let it go, it will go back to normal. For elderly, if you do that, you might break the skin because there's no subcutaneous layer. Okay. So anatomical position, as I mentioned, you can see on the picture, that's anatomical position. That's how the doctors are able to, identify, divide the quadrants, and then they will do, okay, surgery on the left, right quadrant of so and so there's infection. So that's how it's more of the physician, but it's good to know what anatomical position means. Any question, just stop me right there, and then I can explain you better. So this is a anatomical position. When somebody's standing with their arms flat forward and standing straight, tall. So this part, then they is called, they divide it from here and then from the hip. There's lower quadrants, upper quadrants. A cell, tissue and organs. You know that cells make tissue, tissue make organ. So remember that. The structures in the cell, there's nucleus, there's chromosome, nucleus, there are so many structures inside the cell itself. But the only thing you need to know that cells make tissues and tissues make organs. And organs make a system. Remember, just write it down that. And system make a organism. Cells make tissues, tissues make organs, organ make system, system makes an organism. Okay. Those are the stages. Okay. Cell is the basic unit of body structure is called cell. You won't be able to see with your naked eye. You need to have a microscope in order to see a cell. You need a more powerful microscope to see the inside the cell, like what structures are there. Okay. A group of cells with similar function combine to form a tissue. Right. So cells combine to make a tissue. The basic unit body structure, the body has four basic type of tissue. Epithelial tissues cover the internal and external body surface. Okay, there's like a skin, it has 3 layers, and top is called epidermis. Epi means the top. Visceral, middle, and endo is the inside. Connective tissues, anchor, connects, and supports other tissues. So like your muscles, they are connective tissue. Muscles, tissue stretches and contracts to let the body move. So if you didn't have that muscle tissues which can connect, extend, contract, you won't have the movement. You're gonna be like a straight walking, right? Nervous tissue system, they carry impulse in the brain back to the body parts. That's part of the nervous system. It's called chromosomes. No, yeah, that has a nuclear and it has receptors. That's totally different system. You probably don't need to know, but that's what carries the messages from for example, if you touch a hot surface, that instant it carries the message to the brain and back to the muscle to move the hand. Okay. So those are not chromosome, dendrites, nucleus, and then myelin sheath. So that's the nervous system. So if somebody who has the damage to the dendrites, they develop multiple sclerosis, Huntington's disease, Lou Gehrig's, ALS. So they are not able to get proper signal to the muscles. Okay, it is a very complex, system, and it will take you 8 years to 10 years to study the nervous system to know that. And people who have completed that study are known as, can anybody say? The doctors who study nervous system. Nima, do you know what they are called? Neurologist. They do the masters in nervous system, and they are called neurologists who do the brain surgery, diagnose MS and things like that. Okay, the integumentary system. The integumentary system is skin. The integumentary system is known as your skin. It's the largest system in your. If you take all the skin out, Amrit Singh,
Yes, sir.
welcome. Welcome.
Sorry, I think my mic has been on.
Okay,
Sorry.
that's okay. No, I'm glad you joined us. So if you take the skin out and then stretch it, it will cover probably a whole car. You can cover it up, and it's contracted, so it gives you that it closes all the tissues, everything inside, and it's the first protection of your body. Skin has two layers. The epidermis, as I mentioned, and dermis. So epidermis is the top part, and dermis is underneath. And underneath the dermis, there's a layer called subcutaneous layer, which is fat. Okay. So just know the basic. The top part of the skin is epidermis. Epi, anytime you see the word epi, means top. And dermis is the second layer, and visceral and END is the inside. So this is a cross section of your skin. You really don't have to memorize. So just to know, this is the epidermis, this dermis, and this is a fatty layer, and then these are tissue. This is a hair that grows out of your body. This is called sebaceous, which produces oil to keep your skin lubricated. And when somebody gets older, this organ dies. That's why they have the older people, they have dry skin. So you have to artificially apply lotion to keep lubricating. Okay. So epidermis, dermis, and subcutaneous layer. Any questions on this one, guys? On the cross section of a skin? So if I was to ask you, which layer does your body hair grow from? What are you gonna say?
That's subcutaneous layer.
Exactly, yeah. And which layer does the sebaceous gland produce oil?
Dermis.
Dermis, yes.
Dermis.
Yeah. So remember this. There might be somewhere I've seen it, and it might ask you. The skin has many functions. It's the first layer, first of your body's defense. How does skin kills the bacteria sitting on the surface? By raising the temperature. Yeah, the temperature, body temperature goes up, trying to destroy. So temperature, cough, these are your body's defense. Right? So it's trying to kill the virus or bacteria before it enters your body. So if you have temperature, that's good sign. If you're having cough, it's preventing the virus going down your bronchial into your lungs. So you're having the cough. Once the virus is dead, the cough will be gone. There's two types of cough, right? You guys know, productive and non-productive cough. One cough is going to be dry, and the other one, you're going to have phlegm come out. Okay, so the body's preservative covering prevents microorganism and other substance from entering your body. That's why if you have a cut, you need to cover that up, because that's a opening already there for bacteria or some viruses to enter your body. Okay. Nerve endings and skin sense both pleasant and unpleasant situation. So for example, if you touch something which is soft, which is, like one of those gel balls, it feels good because your skin is feeling that sensation. But if you feel something sharp, you're going to remove your hand because you know that that is not a pleasant thing. It also helps to regulate your body temperature. As I mentioned, it will increase the temperature to destroy the virus if it's needed. It is an organ of elimination through the perspiration. How does the body remove the waste through the skin? Is by sweat. So when you're sweating, you're removing the toxins out of your body, and which is in medical term known as, I mentioned this, yes, it starts with D, diaphoresis. The sweat in medical term is called diaphoresis, and it has salt, urea, other stuff that gets moved out of your body. So that's why it's very important to exercise, run, sweat, because then your body is getting rid of the toxins from your body. The musculoskeletal system is your bones in your body. If you didn't have a bone, can you imagine how you're going to be? Like a jellyfish? So bones are the ones that hold your body up. They have the different, and they are very strong, some of the bones. Musculoskeletal provide framework of your body. It's a frame like the house has 4x2s. Your body has the bones to hold it up. It lets the body move. That's why we have joints. There's many times there's a ball and socket joint which moves in all directions. There's a hinge which only moves in two directions. There's other to help the body to maneuver and move. Can anyone name me a famous medical diagnosis bad for bones? If somebody has that, it's really severe. Arthritis is very common. Osteoporosis is very common. These are very common diseases of the musculoskeletal system. Rheumatoid arthritis mostly happens to females and affects the digital with the fingers. The joint starts clotting. So these are some of the diseases. It's not rare, but I'm just letting you guys know. It protects the body and gives shape. And also it consists of bones. There's 206 bones in our body. And some of they're so small, it's like a tiny, especially in your fingers. The phalanges, the bone that makes your fingers, are very tiny. Okay. And it joins with muscles, ligaments, tendons, and cartilage. So muscles are the big muscles. A ligament that joins the muscle. Tendons are the string that are the joints to allow movement, and cartilage is the one that's between your bones. Okay. Any questions, guys? Nope. Musculoskeletal system. So this is your body's cross that you don't need to know all these bones. There are 206 you have to remember. Just remember the basic skull, the ulnar radius, tibia, and like you probably know that lots of elderlies are falling and breaking the hip. There's a small bone where I have this between the hip, which is like a pencil. And when the older they get, it gets brittle. So little fall will break that. And that's what when they go for hip surgery, they remove that bone and then they put like a artificial made of. Sorry?
bus fit tab, no? Okay, continue.
Ron, I can hear you.
अच्छा मौसम ना है जरूर ठंडा मौसम होगा
Okay. Yeah, so that's what they broke, and then they just put that little device and they screw it down to the bone made of titanium steel. Bones. There are 5 types of bone. Long bones, they're heavyweight, like your tibia or your thigh, which is tibia, your ulnar, like elbows are long bones. There's radius, and there's 2 bones in here, 1 bone here, and then your thigh is one of the strongest bone in your body. So if you try to lift someone on your thigh, you will probably be able to do it. Short bones that allow skill and easy movement, like your fingers. Yeah, these are small bones in here, and your toe has the same. They are known as phalanges. They're little tiny bones. They are stick to each other by cartilage, and there's the one that allow your fingers, like a really rapid movement. Flat bones, like your hip bones, they're flat. Your pelvis is a flat bone. Irregular bones, various degrees of movement and flexibility, like your spine. They're all different sizes. Like on your clavicle, like from here to here is clavicle. You don't have to remember. And then it's thoracic, and then it's lumbar, and then coccyx. That's the 4 section of your. So each bone is different size. Sigmoid bone are short and irregular and protect tendons. Like your joints, you'll see on your ankle, like the little tibia, like the small bones that protect the tendons inside. Your knee has a patella, a small bone in front. You can touch it and it moves. It's there to protect the tendons inside. Your elbow, they have little bone here, which protects the tendons inside that allow movement. And the tissues inside the bone are called bone marrows. The function of bone marrow is to produce red blood cells. Okay. And can anyone tell me the disorder if your bone marrow is not functioning properly? The disease that no, it's not a disease, but it is a disorder. Can anybody tell me what it is?
Your kidneys get affected?
No, when your body does not have enough bone marrow, and they don't produce enough red blood cells.
Cancer or like
It's a chronic problem. They have to get bone marrow transplant. Leukemia.
leukemia.
Yeah. Leukemia is the disorder of the bone marrow. If somebody doesn't have bone marrow enough, they get the bone marrow transplant so that the bone marrow starts. It's like a form of it's similar to cancer.
Their hair falls. Yeah. A person who have leukemia.
Yes.
Yeah. Their hair falls, just like a cancer.
Yes, because they get the treatment, right? They get treatment done. The hair falls because of the chemo
Radiation.
Yeah. Radiation, because they go for radiation therapies as well. Okay. They treat almost similar to cancer, but they probably need the bone marrow transplant. So that's why sometimes they're looking for donors, because the blood group has to match the person, and then they do you donate your bone marrow, and then it helps a child with leukemia. Sometimes they grow out of it, the body starts producing it, but sometimes they don't make it more than 20 years old.
So like each person got 2 bone marrows because they can transplant it or donate.
No, like you have a normal bone marrow because you don't have leukemia. So a person with a normal bone marrow can donate like how you donate blood, you can donate your bone marrow, and they will transplant it into a person with leukemia, and a good bone marrow that you gave will start reproducing, like dividing cell, and then that will help to heal the problem the kids have, the leukemia.
Okay,
Yeah.
sir.
Because they don't have the cell is cancerous and it does not divide as a normal person cell would divide.
So this one is bone marrow.
Yeah, bone marrow is the tissue you have inside the bone.
Oh, okay. So they can be transplanted.
Yeah, they can extract it by a procedure, and they will take that bone marrow and then transport to a person with leukemia. Yeah. Muscular joints. A joint is the point in which two or more bones meet. Joints allow movement. So can you imagine if we didn't have any joints, how are we going to be walking around? Okay. So joints, there are 6 types of joints. There's ball and socket, as I mentioned. It's like your shoulder, it moves in all directions. That's called ball and socket. Like the one bone is like a ball and the other one is socket, so it goes inside and it has a 360 rotation. Hinge joint, the movement in one direction, like your elbow. It only goes up or down. It does not go other way. It just goes to 90 degrees, 180 and 90. Okay. Pivot joint allows turning from one side to another. You probably is the pelvis point, your hip, your pelvis. Several joints that allow wide range of motion, like your thigh, like the hip joints. Let's see. 1 second. Yeah. Sorry, I was just saying bye to my daughter. She's going to college. Cordia joints, oval ocular surface in the bone into a oval depression and second occulating bone, like wrist and knuckles. Wrist and knuckles. Just I want to get a heads up. I'm doing a 16-hour shift today. After I finish class, I'm gonna start at 11 p.m. and work until 3 p.m. tomorrow. Yeah.
That's why you won't be teaching us tomorrow.
No, that's my normal. Like tomorrow, I start my rotation, 6 days, and then 3 days off.
You have a 12 hours rotation?
No, I do 8 hours, but 8 hours tonight is overtime.
Oh, good. Lucky.
11 to 7 will be overtime, and then 7 to 3 is yeah. If you guys want to see how a person is dying in the end of their life, come and see me tonight, and I'll go over that. I'll be taking care of somebody who's dying at home. Nima, you want to come and see how when a person is about to die, how they look?
No, that's so sad.
Yeah. So I'll be taking care of giving her medications, shots to keep her comfortable.
Wait, so
I
she
cannot
can
come. I would have come definitely.
Sure, come on.
Well, I'm away now. I'm at it's a 9 hours drive for me now if I want to come.
I'll be in Abbotsford, so.
I'm in Prince George. I'm 150 kilometers away from Prince George.
That's nice.
Yeah, it's -9 over here right now.
Oh, yeah. That's why I was mentioning that lots of people, seniors now are deciding to die at home. And that's why we go in as nurses and just take care of them in their own home.
Wait, I have a question. they just die anytime, right? You don't obviously like give them medicine that could
No,
like
because
them.
the medication for the end of life is if they have lots of gurgles, because the way person dies is your lungs starts filling with water, fluid, and then there's
Mhm.
less room for the oxygen, so they gurgle like how you boil water on the kettle. That's
Mhm.
so then we put atropine. Atropine kind of settles that. It's a drop, or you can give by injection. There's another medication is like perolate that also works with the secretion. And then we give midazolam. Midazolam is a medication that helps them sleep. They just sleep. They don't wake up. And then hydromorphone is given for respiratory depression and pain. And if they are very anxious, then we give Ativan or Haldol. And
So
then,
you don't give them any type of food.
huh?
Do you give them food?
If they want, yeah, we give them food. We could do whatever they prefer. But now I'm going because she's already been 3 days, and after 3 days, the most of the time they just sleep through it. So I have to check every 30 minutes that she's still alive. If not, then I just pronounce it and then call the ambulance to transport her in the morgue.
So now somebody else is with her while you're here.
Yeah, it's 24/7.
Okay.
Yeah.
So when you were with her, did you give her any food or she didn't want food?
No, that's the first time I'm going to her.
Oh,
So I don't know much because they will later on they will email me the care plan, and then I can see the notes that was left by previous nurses. Then I'll get familiar what's happening with her. Yeah. Okay, so there's more than 600 muscles in a human body. 3 types of muscle are skeletal muscle, smooth muscle, and cardiac. Cardiac muscle is for your heart. Skeletal, the one that holds your bone, is over your bone, and smooth muscles. Okay. So this is the cross section of your tissues. You just have to know this. You don't have to memorize any of these. Just know cardiac muscle is only specific to your heart. Okay. And then a smooth muscle is mostly your organs, like your the intestine, the GI system, your kidneys, your lungs. They're all smooth muscles, and then the skeletal muscle are the big muscles that you can pump weight and put some steroids and make it big. Okay. Voluntary muscles can be consciously controlled. Involuntary muscle work automatically. Remember, voluntary and involuntary. Involuntary muscles is your organs. They, even though you cannot stop them or start them, they keep working. With your skeletal muscle, you only use it when you need it. So involuntary is your heart. You cannot the heart muscle, the cardiac muscle, you cannot stop it. It's gonna keep working on its own. Those are involuntary muscles. And voluntary muscles, the muscles you can control. So cardiac muscles in the heart are involuntary muscles. So if you stop your heart, guess what's going to happen to you? You're going to kick the bucket. Muscles have 3 functions: movement of body parts, maintenance and posture, and production of body heat. So muscles produce the heat to maintain your body. What is the normal body temperature inside in your body? 36 degrees Celsius. That's it. It regulates and maintains that. When you start feeling cold, the muscle starts shivering. It starts shivering, and then it's producing the heat. Okay. And when you get hot, you're sweating a lot, it relaxes and tries to sends the sweat to the body, the fluid, to cool it down. Okay, muscles. The involuntary muscles work automatically. You cannot control them. But if you could control, so some people have done it by performing yoga. With yoga, they have stopped the heart muscle. And it was, sometimes you watch on the TV, there's a program called, used to be Weird But True or something like that. And then they've seen the doctors tested, the heart is stopped for like a minute, and then they reboot the heart, and then they can restart. It's 4,000 years of practice. Muscles have three functions: movement, body posture, and production of body heat. Just remember that. What is the functions of the muscles? So musculoskeletal system, you don't have to know the detail, just to know that they're long bone, short bone, flat bones, smooth bones. Yeah, I will just look through it. You don't have to memorize the what are different bones. The most important is nervous system. Without the nervous system, you won't be functioning. But all the systems are good. Okay, the nervous system controls, direct, and coordinates the body function. Say example, you touch a hot pot on the dish. That's how fast the synapse they take the message from the tip of your finger to the brain, and you move your hand. If you didn't have, you'll be holding on to that thing, especially like somebody who has a stroke and they have a paraplegia, like one side is already damaged. Sometimes they have like a bone or something, they're not able because the muscles on that side are damaged. So they'll probably be holding on to a cigarette on that hand, and then you'll see the cigarette has burned and it's burning the finger, but they don't feel it because the nervous system is dead that side. Okay. So if you end up in a long-term care, there's lots of people who your residents go out to smoke. And if somebody has a stroke, you have to keep a constant eye on them, that they are holding the cigarette on the unaffected side. Because if they hold it on the affected side, if they burns through, they won't know. And I've seen many times it did happen. The central nervous system, CNS.
Excuse me. Like when a nervous system gets damaged, and does the person have the urge to smoke?
Yeah, no, they do, because that's the nicotine. The cigarette comes with the primitive part of the brain, and primitive part of the brain is at the back. Your cerebrum gets damaged during the stroke, not the primitive part.
Okay.
Yeah. So anything you learn after you were born, like alcohol drinking, smoking, doing drugs, they are controlled by your primitive part of the brain. The bad words. Sometimes they have advanced dementia, but they still can say F words because that's controlled by the primitive part of the brain. Okay. And then the peripheral nervous system, as I mentioned, daytime is mostly central nervous system and peripheral nervous system. So some of the diseases that's linked with the nervous system, can anybody tell me? The most famous one.
Multiple sclerosis.
Sorry?
That multiple sclerosis.
Yeah, yeah, perfect. And another one is Parkinson's.
Parkinson's.
Yeah, Parkinson's, and multiple sclerosis, ALS, Huntington's, Lewy body disease. All this because your dendrite, the one that carries the receptor messages, get damaged, and that's another, like there's another structure, like within that there's about 5-6 structure. So MS occurs when the myelin sheet, the body recognizes myelin sheet that covers, it's like a thin as a body enemy, and the body starts eating on it. It's like cancerous. So the synapses are not able to jump to, so that's where the multiple sclerosis come in. If you plan to do nursing, you'll learn about that. So this is your nervous system, and the nervous system runs through your spine. Spine is like the network, is the cable that connects, just like how you have the power in your home, but you see outside on the street, there's cables and then they run it through. That's how that is. So the main cable is your spine, and then from the spine, they all go to different organs and different places, and that's where they bring it straight to the brain, back to that those strings, and then you get the message. Okay. So this is the nervous system. I don't have to, just when I have time, just it's in your book as well. Just go through that, and you don't have to memorize the different things, the parts and organs. You just want to know how it works. The brain and the spinal cord. The brain covers the skull, covered by skull. So anything that is very important to your body has built, like skull, and then the ribs cover your lungs and your heart. Those are vital organs, and the organs that can be replaced, they don't. The three main part of the brain are cerebrum, and brainstem. So brainstem has the brainstem is the most important part of your brain. If you damage the cerebrum, yes, you're gonna lose certain abilities. Cerebrum controls your speech, you won't be able to, but if you damage your brainstem, you can die from it. That's why your medulla, your brain prone, your primitive part of the brain are sitting, and they're in the back of your head, and they're covered under the skull. So that's why if somebody hits you with a baseball bat behind your head, you're dead, because that one get damaged. You cannot. That's that controls your body temperature, your breathing, your heart. Everything gets controlled by the primitive brainstem. Okay, and the spinal cord attaches to the brainstem. So this is your nervous system. As I mentioned, this is your cerebrum. If it damages, that controls your speech, your sight, and everything. The big brain, the cerebrum, cerebrum, it's a big one, and damage to that causes dementia, memory loss, and you can still survive. But if you do this medulla, this part of it gets damaged, you're done. The hypothalamus, thalamus, they control your body temperature. And there's a endocrine system here called pituitary gland. That's the master gland of your endocrine system. And that controls all your thyroid, your adolescence, your ovaries, your testes, all the endocrine system. Okay, we'll do. I think it's gonna come up later. The nervous system, the spinal cord lies within the spinal column. It's between your spine. So those backbone you have, the spinal cord has holes in it. So all the wire, they run through that. The spinal cord contains pathway that conduct messages to from the brain. So if somebody has a spinal cord injury, guess what happens? They become paraplegic. Because the signals are not able to come to the muscles and the brain, and then they go paralyzed. And it's happening quite a bit. Is from drug overdose, from car accidents, from mountain biking. People get damaged, or from trauma. The brain and the spinal cord are covered and protected by 3 layers of connective tissues called meninges. And then if your meninges get affected, what is that disease called? You get the vaccine for that when you're a little child. And it's one of your vaccine you need to have a record of before you are going to end up in your practicum. Meningitis.
Oh, I thought it was rubella.
No. Yeah, meningitis. That also will paralyze a person from probably waist down. They will, if somebody is born with that, their legs and won't grow. They'll have a little tiny legs, and if they catch it in the early years, then they go quadriplegic. They're from the hip down, they are paralyzed. So they'll spend most of the time on electric wheelchair. Upper body is working fine, but the lower body gets paralyzed. Okay, that's why we all get the vaccine. It's caused by a virus. Okay, the peripheral nervous system involves the nerve throughout the body, has 12 pairs of cranial nerves. Remember I mentioned about the cranial nerves? The one that cranial nerve 10 that comes to your anus. And if you're doing a digital infection like the digital rectal check, you can stimulate that, and that's directly linked to your heart. And it can stop the heart, and person can die right on the table, on the bed. So very careful when you're doing a digital checks. Okay, and then has 31 pairs of spinal nerves. Spinal nerve may carry impulse from the skin, extremities, and internal structure not supplied by the cranial nerves. So they carry impulse. That's the part of this. It's another major topic on that. Like impulse, like it's electric. It's like electric pulse, positively charged, will jump from different dendrites to one, and dendrite itself has, it looks like a caterpillar if you look under the microscope, and there it always has its own, like, nucleus. It has the myelin sheath, the nodes of Ramira. So each jumps from one snap to another to carry the message. It's like electric signal. The five senses of sighting, hearing, taste, smell, and touch. Okay. The receptor taste buds, receptors for smell are in the nose. Touch receptors are in dermis, that's on the top of your skin. If you touch any part of your skin, you'll feel it that you are touching. Especially in the lips, toes, and fingertips. Lips are the most sensitive dermis. Okay, and fingertips. So as I mentioned to you guys, like the first thing that comes when a person is born is the hearing. The last thing that goes is the hearing. The research is saying that person even dies after that, they can still hear you. Heart stop, but they can still hear you talking. That's why when you're gonna do the postpartum care, you keep talking to them, telling them what you're doing. And that's part of your training as well. You know what a postpartum care is? Anyone? It's caring for
No idea.
caring for somebody after they die. So if they die in a long-term care, what we do is we remove the clothes, we wash the body, give a sponge bath, put a clean hospital gown, and then wait for the funeral home to pick up. During the COVID, we didn't do nothing. Everything went into a white bag. And once the nurse seals that white bag, closes the zipper, nobody can open it. And that was so tough that you cannot even cut it with a razor. And then the funeral home would come, they take that white bag, they put it in another bag, and they bring it, and they all used to go to get cremated in Alberta. So they never opened that bag because they didn't want to spread up the COVID. But normally the postpartum care is the care you provide after somebody dies. Okay. The sensory organs. This is the cross section of your sensory organs. You guys can review that on your own. You just review that because you don't need to know the details, like each part of your. So for the ear, you know that it has three parts. The external ear, which you can see, the middle ear, and the inner ear. From the middle ear to inner ear, it is liquid that catches the sound, stimulates, and sends to the brain. So this is a cross section of your ear. You don't have to know the full detail, but please just review it on your own time. The external ear, middle ear, and inner ear. For you just need to know the 3 layers, and the most important thing is knowing the eardrum. Like if you get a chance, if you go to a practicum, if there's a stethoscope, ask the nurse that you want to see inside the ear of a person. Then you'll be able to see clearly the middle ear and the eardrum. So from inside, there's liquid which is actively charged, like how the car batteries are, negative, positive. That's how the sound gets differentiated and send a signal to the brain. The external ear is called pinna or ecula. The external ear, the one you can see. The eardrum tympanic membrane separates the external and middle ear. So when you look through the stethoscope, you'll see something, when the light will shine at it, is like a moon shape. If somebody has wax built up, then you need to clean the wax to see the eardrum. It's like on a clear day, like how the moon looks in the sky, that's how the eardrum looks. The middle ear contains Escherichian tube and 3 small bones called ossicles. You have considered semicollar canal and cochlear. So that when somebody loses hearing, the surgeons now, they can insert a tube through your cochlear, and they can hear again. They can have the hearing back. Cochlear contains fluid that access sound wave to auditory nerve. As I mentioned, it is a liquid which is charged, catches the sound, try to reprogram it, and then sends to the brain. Okay, the 3 semicollar canals are involved with balance. So if somebody somebody says, I'm feeling dizzy, 9 out of 10 times they have an ear infection. If your fluid goes unbalanced, that's called, the balance is known as ataxia. If you guys want to write that down, ataxia. Ataxia is like when you're looking, you can see straight, but sometimes you lose control. You're stepping on the right, but you end up stepping on the left. That's called like an imbalance, and it's caused by your ear, the fluid in your ear. And 90% time, you have an ear infection. So if you're feeling like dizzy, uncoordinated with your ataxia, go talk to the doctor, and they will probably put you on an antibiotic. Okay. And if you see this kind of sudden change in your patient or resident, you know that's the sign of infection. So sense of taste and smell, the 4 basic taste sensation are salty, sweet, sour, and bitter. And some people after the COVID, they are not able to differentiate some taste now. Sometimes it goes within weeks, months, and my daughter, she is over a year and she hasn't felt the taste yet. Like she feels salty and sweet, but sour and bitter, she doesn't feel it. And it's over a year since they have the COVID going on. Okay. Taste buds contain receptors, and to taste the same way, like the receptors, they carry the signal from your tongue to the brain, and it tells you what kind of taste it is. Olfactory receptors are located in the root of the nasal, right at the root here. Right, it's a smell like something bitter. You can differentiate what kind of smell it is. That's the receptors in the root of your nose. We all have a nose, right? Emma, do you have one?
Sorry?
Do you have a nose?
Which notes?
I said, do you have a nose?
No, so yes, I do have.
Okay. Endocrine system, the most famous disease of endocrine system. Can somebody name it? It is very common. Diabetes. Diabetes is one of the endocrine systems disorder. When the body does not produce enough insulin, that by pancreas, it's one of the organs. The Dutch gland in the pancreas produce insulin, and that is part of the endocrine system. It's a hormone. And if there's no enough insulin, that's when the person become diabetic. And some are born with type 1 diabetes, which is called also known as juvenile diabetes, and they have to be on insulin all their life. The endocrine system is made up of glands called endocrine glands. Endocrine secretes chemical substance called hormones into the bloodstream. Okay. The master gland is, as I mentioned, is pituitary gland. That's the master gland of the hormone. Thyroid is here. It's also part of the your testes, your ovaries, your kidneys. They have on top. The medulla has it. They have all of them. They have different functions. Okay. Hormones regulate activities to other organs and glands in the body. The pituitary gland is called master gland, as I mentioned. And when they want to do surgery, some people, they have problem with the pituitary gland become cancerous. So they go through the upper part of your brain, they open the mouth and they go, and then they remove that from the brain. And the surgery is done from the inside the mouth. And then they have to be on medication rest of their life. Like somebody low thyroid gland doesn't work, so they're on thyroxine all their life to balance the thyroid. Growth hormone. These are responsible for the growth. That was the pituitary gland. And somebody who has too much of growth hormone, they go really big and tall. Like anybody can mention a famous guy that had that issue.
Hulk.
Huh?
Or that Dr. Hulk?
Dr. Hulk, yeah. Remember the wrestler that used to be Andre the Giant? I don't know if Pam or the guys were there. He was 8 foot tall, 800 pounds. That he had the disorder. It was too much of growth hormones. Ron, your radio is coming on my thing. Can you mute yourself? Okay, thyroid stimulating hormone, TSH. which is very common. You're going to see lots of people on levothyroxine. And the common term is also known, the levothyroxine is known as iodine. Okay. So if somebody says I'm on iodine pill, then you know they have that is thyroid pill. Some coprotropic hormone ATH that regulates the growth, development, and function of male and female reproductive, and that's located on top of your kidneys. So that's when that's the master gland that when you reach your age of puberty, that's what it releases the hormone like oxytocin, progesterone, testosterone to let the body know that he's ready to reproduce. Oxytocin comes when to help produce milk, and that's going to be released when somebody has a baby. After they give birth, the oxytocin gets released, and that's what helps to produce milk in the breast. Okay. Posterior pituitary lobe, antidiuretic hormones, ADH. Right? ADH is the one that I was mentioning will give the heart the signal to increase the blood pressure or reduce the pressure to remove the fluid. Oxytocin. Okay. Oxytocin, as I mentioned, will come, so you don't have to worry about the oxytocin because you don't have any Amrit pill. No. Yeah. So when the ladies, they have the baby, that's what gets released by the posterior pituitary gland, telling the breast to produce milk. Yeah. The thyroid gland is in the neck, in the front of larynx. Some people you probably see have a big, like a bulge here. This is where thyroid gland is. And if the thyroid gland enlarged, they will have a little bulging or here. A normal will be straight. Secretes thyroid hormones, T3, T4, levothyroxine, and calcitonin. These are the responsible for, calcitonin is responsible for depleting uric acid in your body. And if there's not enough T3, T4, sorry, what condition you're gonna get? What disease is linked to that? Gout. Have you ever heard the term gout? Somebody says, oh, it's so painful. It affects the lower toe joints. It's gout, it's buildup of uric acid. So the doctors will prescribe calcitonin for the gout. It's a medication. You can take it out orally. There are 4 parathyroid glands. They lie side by side to each other and they have their own functions. The parathyroid gland secretes parathyroid. So they are responsible for regulating your body temperature. So if the first sign, if you're feeling cold all the time, even it's normal, that means you have low thyroid. And if you're feeling hot, even in a cold, you feel like hot, that's a sign that you're hyper on your thyroid. There's too much thyroid hormones get produced by your body. So these are the signs. If your patient goes, oh, I feel hot, but the temperature is like 10 degrees, then you know there's something. So they might have to go let the nurse know or the doctor know, and they can get the blood test done to see the hormone, like how much thyroid is in the body. So the adrenal gland, which sits on top of your kidneys in the medulla, secretes epinephrine and non-epinephrine. Epinephrine is the one that when you have any kind of, like, it regulates the allergies. So you probably heard like some people have severe allergies to bee or severe allergies to peanuts. They carry that epinephrine because the body does not produce epinephrine. So they have to inject themselves artificially, and if every facility, every hospital have a standing, in case if anybody going in anaphylactic shock, they give epinephrine. And they're very expensive. They are like $115 or $120, and they expire every 6 months. So if somebody who has severe allergies to nuts or bee sting or any other stuff, they carry that always with you, because if they don't have an EpiPen, they can die from it, from the allergies. Okay. The adrenal cortex secretes 3 groups of hormone needed for life: cortisone, microcortioids, and small amount of female sex hormones. The pancreas secretes insulin. There's that organ in the pancreas known as Dutch gland. It releases insulin, and lack of insulin is called diabetes type 2. And some people are born with no insulin. The Dutch gland does not produce any insulin at birth. That's called type 1 diabetes or juvenile diabetes. So if you have, I have type 1 or juvenile, that's the, they were born with it. Type 2 is when your body does not have enough insulin. So most of them, they will take insulin injections. They'll be on oral pills. But most of the time, the type 2 diabetes can be controlled by changing your lifestyle. Is helping, getting going, exercising, burning the excess sugar, losing some weight, and things like that. You can control your type 2 diabetes. Male sex gland, testes, secretes testosterone. And testosterone is the one that gives you the boys, the macho, that I am tough. And some of them, they go to the gym and they take artificial testosterone to give them that extra energy to pump the weights. And so female gland ovaries secretes estrogen and progesterone. There are two female hormones. Okay. And then there's another oxytocin, which is only female, but it's released later down in life when they have babies. Okay, cardiovascular system and liver. Okay, I'm gonna stop. It's 10 o'clock. We'll come back at 10:30. Take your break now, and then we'll start at 10:30. Okay.
Okay.
So have we decided any days for that lab practice thing?
Not yet. The school email you guys when you guys all are ready to come at one shot.
Okay.
Okay. The cardiovascular system and lymphatic system make up the circulatory system. Lymphatic system is the body's defense. It kind of alerts the body that there's something is going on, there's infections. You know, the the circulatory system is made of blood.
Sorry, sir. I was having my breakfast.
It's okay. You want me to wait?
No, it's fine. I'm done now.
Okay.
Sorry.
The blood and the blood vessels. What is the color of the blood? Can anyone tell me?
It's red.
Red.
Nope.
The color of the
Blood.
Blood.
cell?
Blood is clear. The red you see is the oxygen, the hemoglobin in there. But if you just extract the blood plasma, it is clear. Have you seen a blister?
Yeah.
That's the blood, the color of the blood, without the hemoglobin in it. That's plasma. When you get blister, that's plasma coming down there to bring in some white blood cells to heal that area. Okay, blood carries nutrients, oxygen, and other substance to the cell. And the final, it goes through the arteries and then goes into the little capillaries and goes inside your cell. Helps stop bleeding and promote healing, which is the responsible. Platelets is the one in your blood that clots the blood, stops from bleeding. And white blood cells are the ones that are responsible for reproducing new cells and healing that area. And some, you probably heard that somebody has blood cancer, that they are lacking the platelets. Because if you get a cut, it won't clot. It won't clot. And I'm one of them. Like if I get a cut, my blood won't stop flowing. So the best thing for me to use is salt. Salt is you can put it on your cut, and it will stop the bleeding. You know, when somebody has an hemorrhage, internal bleeding, they do direct transfusion in the brain. As a high concentration of sodium chloride salt solution, which stops the bleeding in your brain. During exercise, increased demand. So the body, remember the hypostasis, the more demand for the oxygen, then you start breathing heavy. Blood removes the product from the cell, brings the waste of carbon dioxide to the back to the heart, the body, like to the heart, and then it gets excreted out. Okay. It also regulates your body temperature. The system produces and carries cells that defend the body from microbes that cause disease. Okay. And that's the responsibility of white blood cells. I think I mentioned about the memory T cells and B cells in white blood cells. Like every known disease that is on this planet, our body has a defense cell already built in ourselves, which is known as memory T cells. So if the virus, when it enters your body, it will take a day or two for the memory T cells to find out which cells are responsible for destroying it. Once it finds it, it starts multiplying, reproducing itself, and then going and attacking that virus. So sometimes the best thing for if you're getting sick is try to stay away from antibody. Let the body fight its defense, unless like COVID, there's a new H1N1 and the chicken flu, whatever it is, coming out of China. These ones, our body does not have the defense for it, so you have to take antibody. But if you get fever, if you get diarrhea or anything like that, try to avoid taking antibiotic. It's healthier for you to let the body fight itself. Okay, so the blood consists of blood cells and plasma. Plasma is mostly 90% water. That's why it's clear. If you take everything out of the blood, the plasma is clear. The red blood cells is called erythrocytes. Okay. And the responsible for red blood cells is to carry hemoglobin and carry oxygen and nutrients to the cell. To give blood red color because of the substance is called hemoglobin. So hemoglobin is the one that gives blood red color. White blood cells, leukocytes, they protect your body from there's myocytes, there's because if you go in the theory of the white blood cells, there's 5 different types of white blood cells. They are each responsible for different functions in your body. Platelets thrombocytes is needed for blood clotting, and some people like me, I don't have platelets, so that's what I'm lacking. So if I get a severe cut or it's in my they will do transfuse me with platelets to stop the bleeding. Small bleeding I can control it with salt, but if I get I lose a limb where there is continuous bleeding, they have to transfuse the platelets. Okay. The heart muscle, which is also known as cardio muscle, pumps the blood through the vessel and tissue in the cell. Okay. It lies in the middle of the part of the chest. So if you, on the left side, you count up to your 5 ribs, and it sits right there. Like where the 5th rib is, that's where the heart sits. In that little thing, it's like a sitting like that. And then at the bottom part is a little bit twisted, and you can hear with the stethoscope, you can hear the sound, either the 5 intercostal or at the bottom. Okay. The heart is hollow and has 3 layers: pericardium, the outside layer; myocardium, the middle layer; and endo is the surface of the heart. Okay. So remember, endo means the right inner side, pericardium, or epi means outside. So this is your circulatory system. It is made of lungs and heart and artery. Okay. I have after this, if we have time, I'm gonna have a real general question. See if whoever answers will get extra bonus mark from me if I mark the test. So this is your heart. The blue is that's where the heart comes in. You can see right ventricle goes to the lungs, left ventricle, right atrium, left atrium. They have their own function of pumping the blood in. It comes and falls in the heart, then the heart pumps it to the lungs, that it gets oxygenated in the lungs, then it comes back through pulmonary vein, and then it enters the atrium, and then it gets pumped out to the rest of the body. So just to know the function of the heart, it's good to know like how the heart functions, but you don't have to know the details of ventricle, mitral valve, and all this thing unless you're gonna do nursing. Then you're gonna have to know the details of the heart, how it works. The circulatory system has 4 chambers. The upper chambers receive blood from atria. It's the biggest vein in your body, the atria, and the right atrium receives the blood from the body tissue. The left atrium receives the blood from the lungs. So if your right atrium receives it from your body, comes in the right atrium, goes to the ventricle, gets pumped to the lungs, falls back in the atrium, goes to the ventricle, and then gets pumped out to the heart. Okay. The heart has 4 valves. It's called tricuspid valve, 2 mitral valve between the atria and ventricle. So those are the valves that prevent the deoxygenated blood mixing with the oxygenated blood. You probably had like some kids are born, like when the baby is born, there's another process. The valve they only have 3 chambers when they are in the womb, and when they're born up to like 4 to 5 months, they have 3 chambers, and this valve closes and creates the fourth chamber. But in some children, it does not, and they have to be surgically implanted. So you probably had like, some kids were born with a problem with the heart. That's what it is. The valves are not there. The aortic valve between aorta and aorta is one of your biggest vein, and the pressure in the aorta, if you cut it, it's gonna go up to 4 meters. The blood will shoot up to 4 to 5 meters. It's like a hose pipe, stick. Heart action is two-phase. That's, as I mentioned, the blood pressure, resting phase, systolic working phase. So the systolic on the blood pressure is the up part, which is the pressure the blood leaves. The diastolic is the low, is the resting phase of the heart when the blood falls back inside the heart. If somebody has a high blood pressure, also known as hypertension, what can happen? What can happen to that individual? I mentioned this earlier.
He might get heart stroke.
Awesome. Yes, somebody's paying attention to my lecture. Yeah, stroke results from high blood pressure. Okay, the circulatory system, the blood vessel arteries carry blood away from the heart. The aorta is the largest artery. It sits right here. It comes up to your neck, and then it twists and goes down. It's like almost like a hose pipe, that size. Capillaries are thin, tiny, that is arches out from the arteries and goes inside your small tissues. They are called capillaries. Veins retain the blood to the heart. Valve smallest from the vein. Valve is small. There's 2 types of condition you can get if somebody is getting a blood clot: is arterial ulcer or venous ulcer, and mostly happens in the lower extremities. It's similar to diabetes ulcer as well. They are all like the valve inside busted. There's no circulation in the tissue. The cells around it dies, and there's a big hole in there. Stage 4, stage 3, and then the whole tissue is damaged. Sometimes there are new dressings available, which is like $500 to $600. You can this epithelial cell is known as Oasis. You can use that to refill it, but most people cannot afford that. The treatment is about $500 a month. And epithelial cell is made from the Oasis is made from pig's intestine. They take the live cells out of the pig's intestine, make into a dressing, and once it goes to the human body, it starts to reproduce new cells and fill out the indulge wound. Okay, you got right? So yeah, and then the insulin, the Humalog, is made from pig's liver. So lots of medications is made from the pig's liver. I mean organs. And the long-acting, the Gangray and Lantus is made from beef liver, and the Rapid is made from chemically made it in the lab. There's 3 different types: is rapid acting, intermediate acting, and long acting. Lymphatic system, made of lymphatic organs, lymph node, ducts, tissues, capillaries, and lymph node. There's 2 of them are located underneath your armpit. So I mean, Nima and Pam, when you guys are doing your breast self-examination, that's what you feel for. If you feel that infiltrate, that means there's something wrong. You guys do your self-examination?
Not really.
Maybe you should start, because this breast cancer, you're detecting for any lumps, and that lump could be cancerous. Because my sister just passed away 6 months ago from breast cancer, young, 33 years old.
Oh.
Yeah, so you guys need to start. So, if I meet you guys in a class, then I can show you how to do a self-exam.
Okay.
And then what you're feeling underneath your armpit is the lymph node, if it's swollen. And right now, if you touch, you don't feel anything. But if you're getting any kind of cancerous, if you touch it, you're gonna feel like a balloon in there, like a little node. Okay, it's very important you guys start doing that. Lymphatic vessels, and you too, Amritpal, you know that men also get a breast cancer, right? On your around your nipple. There's males who also have. So always try to, feel for any lump around your nipple. That if there's any lump, see the doctor right away. They can do biopsy and they can test it if it's cancerous. Lymphoid organs, concrete lymph node, tonsils, thymus gland, and spleen. So these are the spleen is part of your lymphatic system, which produces the antibiotic food that's needed on your body. And tonsils, we all got it when we were little kids. And they can be surgically removed, or you can just leave it, and it's right up here. Those are two of your lymph nodes. You guys got the tonsils?
Yes.
Yeah, I got my surgically removed when I was a kid.
So those were your two lymph glands, lymphatic system. So now you are less two lymph nodes. So okay, lymphatic system. The three main functions maintain balance.
Yeah, my body feels lighter now.
Okay. It maintains the balance of fluid between the blood tissue, which is called homeostasis. Homeostasis, on your own time, just Google homeostasis. There's hundreds of different types of homeostasis of your body. Just remember, like you're sitting on that bench, you're going back and forth when you're kids. It has to be balanced. If one goes down, the other one kicks in to bring it balanced. That's homeostasis. It forms the body's immune system. Immune system is body's system that fights the infection. The facility absorption of fats. So spleen is the one that produces the chemicals to get rid of your fat in your body. There's something I just came in my mind I'm going to discuss with you. We are fighting actually for this as well. The union are debating with the government. If somebody has AIDS or HIV positive, they're not. They can it's their right not to reveal that. So they don't have to put it in the diagnosis, like when they get admitted in a long-term care or. So we are fighting because apparently one of my co-workers was he gave an injection and he had a needle back stabbed, and then once he had a stab, he went to the hospital because any kind of needle injection, we cannot take it out. We go with like that to the hospital. And when the doctors pulled out the medical background of the patient, he was HIV positive, which we did not know at the facility level. So they end up testing him for HIV for like a month. He was off work. But that's what the union are now fighting after like some incidents like that, as the healthcare workers, we have right to know if they are HIV positive or have AIDS. So maybe by the time you're going to start, it's in the courts right now by the union, the HEU and BCNU are fighting for that. So older people, and then another way of knowing if somebody is HIV positive, when you're doing the morning care, if you feel a lump on the lymphatic system underneath the armpit, you know there's something wrong. Because somebody who is HIV positive, the immune system, lymph nodes would be inflamed. And the body can less to attach the antigen. So, that's the difference, like how the antibiotics work is they attach to the antigens, and then goes with the white blood cells and opens up and then engulfs the bacteria and destroys it inside the cell. That's another theory that's called megacytes, something like that. It's a part of the white blood cells. Now we're going, any questions on circulatory and lymphatic system? So the respiratory system is your lungs, your trachea, your nose. That's where the air comes in. the alveoli on the lungs are the ones that are responsible for oxygenating the blood. People who smoke a lot, it destroys the alveoli. That's why if you're gonna listen to the lungs, you're gonna hear crackles. Crackles, and then if there's fluid, it's gonna be wheezes, which you guys don't know. We're gonna be doing any escalation of the lungs, but it's just good to know. So if the nest says I had some crackles, you know what it is. I don't know if you guys seen that old carbon papers that in olden days they used to use, would put between the 2 pages and then the right to make a copy. So when you cram that, yeah, so that's how the crackles sound. Wheezing is sound as like a air going through the tunnel. That's called wheezing. So if you listen to the lungs with the stethoscope, you'll hear the wheezing, like the water flowing through the tunnel. And if you hear this crackle, that means there's fluid buildup. Okay? Little extra for you. The respiratory system, system brings oxygen from the lungs and removes the carbon dioxide. The respiration involves inhalation and expiration. You breathe in, you breathe out. The lungs are spongy tissue filled with alveoli, blood vessels, and nerves. So all the blood comes there in the alveoli. Do you guys are familiar with the process of osmosis? You did in high school? Nima, Pina, Tema, do you guys know what osmosis is?
No, what is that?
Nope.
Okay, osmosis is a process where the solvent from the higher concentration moves to the lower concentration. I don't know, like we try, like in the high school, we did that with the potato. So we put salt, like really strong salt solution, and we soak the potato overnight. So all the salt went inside the potato, through the membrane. That's how the alveoli, the oxygen get filtered. So the air coming from the you breathing in, there's more oxygen, less carbon dioxide, and then the blood inside the alveoli has more carbon dioxide and less oxygen. So this is where the diffusion takes place. So the carbon dioxide moves out and then the oxygen moves in. So that's how the process through the membrane. And then you breathe out, you expelling the carbon dioxide, and the oxygen has gone already in the blood. And that's how the filtration takes place, diffusion. Yeah. Okay. Are you guys clear with that?
Yes.
Yes, sir.
Yeah, so that's the process of osmosis. If you did chemistry in high school, you probably would have done this experiment. So each lung is divided into lobes. Remember, on your right side, there's 3 lobes. On the left side is 2 lobes. Left has 2 lobes, and the right has 3. So that's why if you want to listen to the lungs for fluid buildup, if somebody has COPD, which is chronic obstructive pulmonary disease, there'll be water, the fluid buildup, and it's gonna listen on the back side of where the ribs end, and you put it on the back and you listen to the lungs. And if you hear that crackles, you know that there's fluid in the lungs. So they probably will put on a medication called furosemide, or also known as Lasix, to dry out the lungs. Okay. The immune system protects the, I think I'm going back. Oh yeah, the immune system protects the body from diseases. A defense against threats outside. Non-specific immunity is body's reaction to anything that it does not recognize normal substance. So right now, there's quite a bit of viruses coming that the body does not know. New viruses are created in the lab, and you know, some countries, they create the biological weapon, which is the virus that can destroy the whole country with the virus they have created in the lab. So those are known, if you probably have the term biological weapon, that's the virus they have created. Chemical weapon, they have created some chemicals which can, once you breathe, you're dead. So mechanical barriers, because the body does not know that virus. Chemical barriers, because there's some chemicals that the body does not recognize. And, for example, carbon monoxide poisoning, it is odorless. You don't even know you're breathing in, and it goes inside your body, takes all the oxygen, and you're dead. Reflexes, phagocytes. Yeah, that's the one that in the white blood cells destroys. The way it works, say this is the virus, the phagocytes will come, open, go around it, and enclose it inside it and destroy it. So the phagocytes are the cells in your body that destroys so anytime you see cyte, C-Y-T-E means cell, one cell, cyte, monocyte, phagocyte, leukocyte means cells. So inflammation is in like swelling of the body, like, if you hit yourself, the white blood cells will rush to repair that area, and then you're going to have a swelling. Things like that. Like if you injured somewhere, there's a little bit of swelling, there's inflammation, because the white blood cells has gone there to repair the damaged tissues. And fever. Fever is one of the body's defense. It raises the temperature and to destroy the virus that's in your body. So if you have, if you think you have infection, and if you have high fever, try not to take anti-inflammatories like Tylenol, Advil to bring the fever down, because you are promoting the virus to go and destroy the good cells, because the body is trying to fight it. So let the fever be. That's why some people, they have fever, they take Tylenol and stuff to bring the fever down. And guess what? They get more sick because the body is not able to destroy the virus that has entered your body. Just a little hint. That's why when the babies, they have fever, when you take them to emerge, unless it's like a crucial, like 39 and up, then they will probably try to bring it down by putting them in a cold water. But if it's like 37, 38, the doctors will leave it alone. They won't even give any medication for it. Okay, the process, the special cell and substance that function to produce immunity antibodies, they are like part of your red blood cells, white blood cells, the antibodies, antigen. They are like hooked. If you look at them under microscope, it will look like there's pointy things, and those pointy things engulf the bacteria and destroys lymphocytes, right? That's part of the white blood cells. The cyte, B cells, remember I mentioned, and T cells, the B memory cells and T cells. So B memory cells are there in your body. And that's why when you get the immunization, like TB, meningitis, polio, all these viruses at a small dose was introduced in your body, and that you guys have the B cells for that. So if you ever get exposed to it, that's what then the B memory cells will produce the T cells and destroy them. That's a COVID vaccine. So they inject a little bit of virus in your body. So if you get the COVID, it will the memory cell will reproduce and become T cells and destroy the COVID. So that's how it works. Same thing with hepatitis A, B, C. It's very common in hospitals if you end up that lots of people are coming with Hep A, B, and C. So it's a good idea to have your body immunized with. It will take you, I think, 6 months to get all 3 shots. You have to get first one weight, then get the second weight, and then get the third. But it's a good idea, and it's good for life. When the body senses antigen, an unwanted substance, the immune system reacts. Naturally, the immunity can be acquired in 2 ways. Active immunity from the natural antibodies after the illness. So after the illness, like if you get a new virus, the body produces antibodies. And once the virus is destroyed, it becomes a B cell. And it's going to be floating in your body for 20 years, 50 years, until you get that virus again, and then it will reproduce, multiply, and destroy the virus. Passive immunity, short-lived task, and about 6 months. One thing about I just remember, like we all got that TB shot when we were little kids. Each time you're gonna go for your TB test, you're gonna become positive. So what I would suggest, instead of going and spending like $60 to get your TB test, because you're supposed to get it done every 5 years, speak to the doctor and get an order for X-ray, chest X-ray for TB. And the X-ray will, because after you do the test, if you're positive, you're gonna go for your chest X-ray. So might as well just speak to the doctor. That each time you go get a TB test, it shows positive, he will just write a prescription to get it done. So it's free anyways if the doctor writes it. So you don't waste your money going. I know, like, I don't know you about, but me, if you have the mark on your elbow, that means you had the TB shot.
Shoulder.
Yeah. So yeah, just talk to your doctor. Just get the get a chest X-ray. Because mine, I have to do every 5 years, and it always comes positive. Then I stop going and paying that money. So I always, like, when it comes to renewal, the Fraser Health sends us the email that you need to get your TB test done, and then I just go for X-ray.
Oh, so like, sir, last time when we came from our country back home, they did a medical test, like there is X-ray and everything. So will this work?
No. You need a specific for, because the one that do from immigration, that's broad, they check for everything. But here they will just only do for TB. If there's any, because we already have TB vaccine virus in our body, injected. There's B memory cells. So when because what they do is, when they do the TB test, they inject a little bit of TB virus. So our body then recognizes it, and then the T memory cells, they rush to the area to destroy that TB virus, and always be positive, because it inflates to like 2 to 3 centimeters.
And if you have that round thing on your forearm, do you still need to go for that TB test?
Yeah, just let them know that, like, wherever you're gonna go, just talk to your doctor.
Okay.
Whoever your family doctor, just say, you know what, I need TB test, but I have the TB shot, and it will come positive. So why don't you give me a right for TB test, just X-ray.
Okay.
Yeah, because once you go to the TB test, if it's positive, they will send you for X-ray anyways. So might as well.
So why just go straight away to the X-ray thing?
Yeah, so why waste the time doing that? Because right now the TB test is for 69 plus tax. But unless you end up with a good health authority, they will reimburse those money, because they require that. Okay, digestive system. We did the bowel elimination, so that's part of the digestive system. Breaks down physical chemicals so that it absorbed and used by the cell. Removes solid waste from the body. The digestive system involves alimentary canal, GI tract. The digestion starts from your mouth, ends up in your anus. Okay. And all solid waste from the body. The digestive system involves GI tract. So it starts from your mouth, the tongue, the saliva, then it goes through your esophagus, goes to your stomach, then goes down the stomach, through the gallbladder, where all the like the fats, the lipids get filtered by the chemicals spread by and then it goes into small intestine, to the colon, and out of your body. Urinary system, you just did it a few days ago. Urinary elimination, same thing, removes the waste from your blood. What is the waste that comes out of your blood and goes in the urine? Anyway, say? Urea.
No idea.
Urea. So urea is the one that's get pulled out from your body. That's why they call it uric acid when it mixed with the water. And that's, if you don't go to the washroom on time, if you keep holding it, that's the urea becomes solid, and that's what becomes kidney stone or renal calculi. So it's very important to drink lots of fluid, and if you have urge to go void, go, don't hold it. If it sits in your kidneys long, it will form a renal or bladder calculi, forms a crystal. Okay. So your urinary tract is made up for your kidney, your adrenal gland, as I mentioned on top. You can see that area is known as medulla. That's where the hormones, they go to the brain. The brain signals the heart to pump, increase the pressure, to pull out it, and then also the adrenal gland senses that there's not enough fluid. You can go dehydrated. It will again send the brain to the signal to slow down the heart, so less water fluid get pumped, and comes through the ureter into your bladder, and then it gets excreted out through the female meatus, and male is the urethra. Okay. And most of the time, you're going to see if somebody has bladder cancer, they will, this is where they put the suprapubic catheter. They put a catheter straight in the bladder, and they close this part off, and that's where it comes. And then if there's a urostomy, if the ureter and the bladder is all cancerous, they cut this tube and they put straight from the kidneys, and it'll be hanging out on your back. There'll be 2 bags, and you're going to be emptying those bags with the urine. Urinary system, the kidney has 2 bean-shaped organs, and they sit behind your back. Like if you touch your back, you feel the bone on your back hip, go 2 centimeters up, you feel that little hole area. That's where the kidney sits. It's called peritoneal area. So that's where your kidneys are. If somebody complains of back pain, always check the urine if they might be having an infection. So that's where that's the peritoneal area. That's where your kidneys are sitting. Each kidney has 1 million tiny nephrons. Each nephron works basically with it. So also in the kidney, the same way it gets filtered. The waste gets filtered through the glomerulus. There's a tubing called glomerulus. So the urine will come there, that will reabsorb, and then the waste and everything moves out by the process of they diffuse into the fluid that's in there, and the waste get depleted. That's how it comes up. Same way the lungs get filtered, kidney also has the tubing is known as glomerulus. The ureter carries urine from the kidney to the bladder. So it goes through the tube and goes in the bladder. The store of the bladder until they need to urinate is felt. Right now there's a bladder scanner. Like if you feel that somebody hasn't voided, you can just scan. It's like same as the ultrasound they do. You just put it on the bladder and scan it with the gel on it, and the machine will read how many mils of urine is in there. So normally the maximum would be about 2,000. That's how the average capacity of your bladder. 2 liters it can hold. And finally, the reproductive system. Human reproductive results in the union of male sex cells and female sex cells. So the spermatus, the vagina goes through the cervix, goes through the uterus, enters the fallopian tube, and then waits, meets the egg that's released by the ovaries, and the fertilization takes place inside the fallopian tube. The uterus, they build up a membrane on the endometrium, they call it, and waits there. So if the egg drops in, they call it zygote at that stage if it gets fertilized. If the zygote comes in, that's where it attached to that membrane. So that membrane that's there, if there's a fertilization, if there's a pregnancy, that membrane becomes placenta. And that's where the baby develops. And if there's the egg drops and there's no fertilized egg, that becomes your menstruation cycle, which breaks. And then every 28 days, it will come as your menstruation. Understand? So that's why the menstruation ceases when somebody is pregnant. Okay. Any questions on that?
No, sir.
Okay, so the reproductive system, you can see this. These are for the male. The symbus pubis, that's a very sensitive area as well. And if you have a patient who has difficulty urinating, if you massage that area, most likely they will urinate because it's very sensitive. Corpus, just the epidermal, colon, testes, and these are the cross sections of male reproductive. So just know it by that. Okay. You don't have to memorize like every part of it because you're not going to be gynecologist. So male reproduce, the male sex glands are called testicles or gonads, which produce testosterone, which is the male hormone, and also helps in producing sperm, which when it leaves the testes, it gets semen from the prostate gland, which sits right around your urethra. So when the sperm comes in, the prostate gland releases the semen, and that's what the semen you'll see will come inside the come out of the male, containing the so it flows inside the vagina, goes up to the fallopian tube, fertilization comes play. Each time there's about they say 1 million sperm in there, and only one of them get to fertilize an egg. Travel from each testicle to epidermis. The prostate gland lies below the bladder, secretes the fluid semen, and increases the mobility. So they are kind of swimming in the semen that produces a prostate gland. And then for older men, most of them, they have an inflamed prostate, which is difficult for closes the urethra. So they are on medication for prostate. And then it could become cancers as well. It's one of the most common cancers for male is prostate cancer. So the penis contains erectile tissue. So when it is stimulated, the penis gets the blood flow. There's no bone in there, so the cells start inflating like it's like a balloon. When you blow air, it starts growing big, and that's how the blood comes in, and then they get the erectile. Some older people, they don't have that ability, so they take artificial medication like Cialis and Viagra to increase the heart rate for the blood to flow there. Okay. Any questions?
Not yet, sir.
Okay, so this is the female reproductive system. What do you call so you just know where the vagina is, where the meatus, where the uterus sit, and ovaries release the egg. This is your fallopian tube. That's where the fertilization takes place, and then it drops inside the uterus, and that's where the formation plays. If it's not fertilized, then it becomes your menstruation cycle, bringing out those membrane that is automatically built by body for pregnancy. And if it's pregnant, then that's the part that becomes placenta. Right now, if, the uterus is like probably a size of a kidney bean. So once it gets, as soon as it gets the pregnancy, it starts growing. Okay. The external female genitalia is called vulva. This is a skin around the vaginal area. It's known vulva. There's Livia majora and Livia minora. Livia majora is the outside. The minora is the small one inside. The Livia majora and Livia minora are the two folds of the tissue on each side of the vaginal opening. Okay. The clitoris is a small organ composed of erectile tissue, and it becomes hard when it is sexually stimulated. It's like similar to male penis. It doesn't have anything, but the blood flows and makes the cells inside hard, and it is very sensitive. The mammary gland, the breast, secretes milk after childbirth, and the hormone responsible for that is, I mentioned that, oxytocin. Menstruation is if the pregnancy does not occur, as I mentioned, the endometrium, blood lining of the uterus breaks and it discharges from the body through the vagina. So that's your monthly menstruation cycle. The unending of sperm in the ovum into one cell. During intercourse, millions of sperm get deposited into the vagina. The sperm and the ovum unite in the fallopian tube and fertilize as a result. So if I ask you the question, where does the fertilization take place? Where do you say?
It's in the ovum.
No, it's right here, fallopian tube, the tube that carries the eggs from the ovaries to the uterus. So the fertilization takes place inside, and the first stage of development is known as zygote. The fertilized cell implants at the thickened endometrium and grows into pregnancy. So if it's fertilized, the zygote is there. The membrane that the uterus builds, it's going to stick to it, and that's where the umbilical cord starts growing, and that becomes your placenta.
But it takes place in like the ovary, right, and like the uterus.
No, the fertilization, the sperm travels all the way through the uterus, goes up to the very close to the air where the ovary is, and sits there. When the ovary releases the egg, it goes there and fertilizes it. So, and then while the fertilized egg is coming down, it forms like there's already cell division is going on, and that first stage is known as zygote, and then it will drop from the fallopian tube, come into the come on in the uterus, and will stick to the membrane that's in there. That's it. So some general question. Have you guys heard about stem cells transplant?
No.
Yeah, stem cell transplant are they using now as a new technology. They take the cells from the placenta and umbilical cord and transplant it into somebody who has cancer, somebody who has leukemia. So those cells are baby cells, and they start reproducing and heal the problem. It's one of the new technologies was started maybe about 5 years ago, and it's growing really fast. Okay, I have a question. What organ in your body, if you cut it in half, it will regrow itself?
Yes. Sure.
Yeah, there's one organ in our body that if you cut a piece out, it will grow back.
The liver?
That's the liver. Yeah. So now the scientists are researching the what cell in the liver that is actively regrowing itself, so that if somebody loses a limb or something, they can regrow the limb. Like a lizard, it breaks its tail off, but then it can regrow the tail. Same thing with like alligators, they lose a limb and they can regrow it. So that's what the research is now. What is responsible for regrowth after it damages? Okay, just give me 1 second. Okay, sorry guys. So yeah, we've done the slides. What do you guys want to do? You want to go over the quizzes that the workbook?
Can we finish the homework?
Yeah. Yeah, you can, you guys done? I'll give you about 10 minutes to finish everything and then we'll discuss that together. Yeah, the matching and then the next page, and then I'll give you guys to work on
Sorry, what was the homework?
the workbook for the topic we did yesterday. You guys done? Oh, tomorrow you guys have a huge chapter. It's total of 71 slides. So whenever you guys ready, just let me know. You guys have a new teacher now.
Yeah, he's very cute.
Yeah, you're supposed to be teaching. You're supposed to be teaching. Okay, niche, bro. Okay. So teach now. You're supposed to be teaching, dude.
Like you guys can carry on with discussing the chapter because I haven't gone through the chapter, so I haven't done it.
No, we did half already this morning. There's only half left.